I'm Dr. Mudit Khanna, Senior Consultant Orthopaedic Surgeon at South Mumbai unit of Wockhardt Hospitals. I have special interest in joint replacement surgeries and specialize in these surgeries being performed with the use of computer navigation and robotics. And in my opinion, it has been a game changer when it comes to clinical outcomes, radiological outcomes, as well as the speed at which patients tend to recover post invasive procedures like a knee replacement. Today, we will be talking about Mr. Peter Wood, a 76-year-old gentleman who came to us with significant degree of pain and disability arising from his arthritis in the knee. In his home country, he had been advised a total knee replacement surgery. However, when we evaluated him both clinically and radiologically, found that his arthritis was limited only to one compartment of the knee, or the inner compartment. This is the right knee. Now, as we can see, the bone at the top and the bone at the bottom appear to be grinding against each other in the inner side or the inner compartment of the knee, while the outer compartment of the knee has preserved joint space or preserved cartilage. So as we can see, the disease or the arthritic process is limited to only one compartment or the inner compartment of the knee. For a moment, if we look at the opposite X-ray or the left X-ray, we can see that there is good amount of joint space which is preserved both in the inner compartment as well as in the outer compartment. So for this particular knee, no surgery is required. However, on the right knee, in the inner compartment, there is bone-on-bone arthritis which requires some form of replacement, either a total knee replacement or a partial knee replacement or resurfacing procedure. So what we offered him was a procedure known as Makoplasty. Now, Makoplasty is a very, very exciting new addition to all the things that we can do in a patient suffering from osteoarthritis of the knee. Now, Makoplasty is essentially a resurfacing procedure where we only remove the worn out and damaged part of the knee, and we leave the entire other intact good components of the knee absolutely intact. None of the ligaments are interfered with, so the knee after a Makoplasty behaves almost like a natural knee. Now, this is the X-ray after the surgery, and as we can see, this is the inner compartment, this is the outer compartment. The outer compartment stays preserved, and in the inner compartment, we've put a small cap on the femur at the top, a small tray on the tibia at the bottom, and slid a small cushion in between the two bones. Now, as we can see, rather than having a cap from here to here on the entire femur and the entire tibia below, there is only a small amount of resurfacing that has been performed to achieve good results. Now, typically it has been seen that about 75% less bone is removed in a procedure like Makoplasty compared to a total knee replacement. It took us about an hour to perform the procedure. The same day in the evening, we made him stand, we made him walk, and he was walking without a support right from the first day itself. He made a steady recovery, was discharged on the third day, and when he came to us for follow-up, it's been about a week now, and as you can see today, he's walking reasonably comfortably. It is difficult to tell by the way he's walking that he's undergone a procedure like a knee replacement or a partial knee replacement just about a week ago.